everyone. So today I'm going over some NCLEX respiratory questions. You know how hard it is for some people to answer the questions on respiratory. So that's the reason I decided to go over some questions today. If you're new to the channel, don't forget to subscribe and click on the bell notification so you can get a notification each time I am live. Okay, so we're going to start. I will put some questions and we're going over them together to find the right answer. There we go. Okay, here, this is the first question I have. First, let me check if you can hear me. Okay, 1, 2, 3. Let's see. Let me enlarge it a little bit so you can see. Okay, here the first question. The nurse caring for a client with a chest tube turns the client to the side and the chest tube accidentally disconnects from the water seal chamber. Which initial setting or what is the first thing the nurse will be doing after the chest tube is accidentally disconnected from the water seal? That is one of the questions that you will have in your exam. This is a very important question because it is an emergency situation. So there are two questions that are almost the same, but they're not the same. For example, they might tell you the tube is disconnected from the chamber, from the water seal, or the tube is disconnected from the patient. So there are two different ways of answering those questions. So now we will be working on this one right here. The chest tube is accidentally disconnected from the water seal chamber. What will you do as a nurse? So we have 4 different answers and you will choose the best one. The first one is, let's see, it says call the healthcare provider. If the chest tube is disconnected, is it the first thing you will be doing? We don't know. Let's go to the second one. The second one says place the tube in a bottle of sterile water. Do you think it's a good choice? Let's go over the third one. The third one says replace the chest tube system. Will you replace the entire chest tube system because the tube is disconnected from the water seal chamber? No, I don't think so. Okay, the last one says place a sterile dressing over the disconnection site. It says to place a sterile dressing over the disconnection site. Will that stop the water or air from coming out or something? Will that really fix the problem? I'm not sure. So let's see what will be the best answer. So since the tube is disconnected from the chamber, not from the patient, so that means the patient is in danger if you don't act quick, because what is helping the patient right now is the chest tube. So if the patient is not connected to the chest tube, so you see what's going to happen, right? Air can go through the tube and cause a bigger damage to the patient. So what we're going to do we will be choosing number 2. You know why? The air, first we need air, the air that is, we don't want air to go through the patient, right? So what we're going to do, we're going to take the tube that is, normally the tube is connected to the patient still, but it is disconnected from the tube. So we will put the tube to a water, we'll put it into the bottle of stale water. That will stop any kind of leak, any kind of air from getting to the patient. This is how you answer that question. If you have a different question that asks you, what would you do if the tube is disconnected from the patient, that will be a different story. So now you will be taking care of the site, you know, the where it's disconnected from the patient. But now we are taking care of the place that is disconnected from the tube. Okay, so you will put that tube into the water, into a bottle of stale water. Okay, so this is the answer. Let me change the color of the answer so you will know this is the answer. Okay, guys, this is the answer. So let's go to our next question. I'm going to add it right here for you. Okay, here you go. The nurse is assessing the functioning of a chest tube drainage system in a client who has just returned from recovery room following a thoracotomy with wedge resection. Which are the expected assessment findings? Select all that apply. You know, I know most of us don't like the select of the all that apply question because they are very confusing. So let me put the first answer. The first answer is okay, and I put it paste. Okay, it says excessive bubbling in the water seal. The second one is vigorous bubbling in the suction control chamber. While I'm putting the answers, you can go over the question and then you will see exactly what would you do if you are assessing the functioning of the chest tube drainage system in a client who has just returned from recovery room. Okay, so that's the third one. The third one, drainage system maintained below the client chest. You will have, in that kind of question, you will have to choose several ones. If you choose one more, you lose the entire question. If you choose one less, you still lose the entire question. This is what is very scary about the select all that apply ones. Let's add one more. Okay, the fifth one says occlusive dressing in place over the chest tube insertion. What if we add another one? Let's add another one. Okay, let me receive. I'm gonna remove this one and put this one instead. Okay, guys. So now, which one of these answers will you choose? Okay, first it says, let me read it again. Nurse is assessing the functioning of a chest tube drainage system in a client who has just returned from recovery room following a thoracotomy and with a wedge resection. Which are the expected assessment finding will you choose? You go doing an assessment. What will you find during this assessment? Do you think the fluctuation of the water seal in the tube in the water seal chamber during inhalation and exhalation is normal? I would say that could be one of them, because when the chest tube is working, you will see a fluctuation in the water seal. That's why you will see like a intermittent bubbling and that. This is normal. So we will choose this one. Let's choose this one. Okay? What do you think about this one right here? Vigorous bubbling in the suction control chamber. Anytime you see the word vigorous bubbling, this is not normal. That means there is a leak somewhere in the water seal, in the chamber, in the control chamber. If it was like gentle, that would be a different story. But if it says vigorous, this is not good. So we're not gonna take this one. What about this one right here? Drainage system maintained below the client chest. Do you think we should maintain the drainage system below the client chest after a surgery, after a thoracotomy or something? I would say yes. You know why? You put it below, it's like gravity. Because of gravity, you will put the drainage system below the patient chest. That way the water can go down from the chest, because the patient is higher, is positioning in a higher position. So the fluid will go down. That's the reason we have to make sure we put the drainage system below the patient chest. Okay, so we will choose this one also. Let's change the color just for you to remember. What do you think about number 4? Number 4 says 50 ml of drainage in the system, in the drainage collection chamber. 50 ml. Do you think that's the right amount you're supposed to have? The drainage, let me see it said the drainage that is more than 70 to 100 ml per hour is considered excessive. That means if it's over 70, it's excessive, but 50 ml is good. So you have to remember that, guys. The drainage, you remember the liquid of the drainage collection chamber has to be less than 70 ml. If it's 50, it's good. So we're going with this one also. What about this one? Number 5. It says occlusive dressing in place over the chest tube insertion. Do you think we need to place an occlusive dressing over the site? Yes, we have to. There's a certain way you have to tape the dressing. You tape it in 3 side, and then you leave one. You know, we have in a square we have four side, so you have to tape it in 3, and then yes, occlusive dressing is very important. So we also choose this one. Okay, guys. So this is things that you have to make sure that you do after a thoracotomy. Okay, let's go to the next one. Next question. Let me add the question for you. This is simple. Okay. The nurse is assisting a healthcare provider with the removal of a chest tube. The nurse should instruct the client to take which action? So when the doctor is removing the chest tube, how can the nurse help the doctor in that process? So let me put the choices for you. The first one says exhale slowly. That's what you're going to ask the patient to do. You will ask the patient to exhale. You know, the exhalation has to be slow. You know, we inhale and then exhale. That means the expiration has to be slow. This is one of the choices. That doesn't mean it's what you will choose. So you will see within those 4 choices, and then you will choose the best one. The second one says stay very still. Will you ask the patient to stay very still? We'll see. Let's see the next one, and so we can decide. The third one says inhale and exhale quickly. Inhale and exhale quickly. Are you going to ask the patient to do it that way? And this is the last one. The last one says perform a Valsalva maneuver. You know what is Valsalva maneuver, guys? It's when you ask the patient to like bear down and then hold and push like this. So which one you think is the best choice? Will you ask the patient to exhale slowly? Will you ask the patient to stay very still? Or will you ask the patient to inhale and exhale very quickly? Or will you ask the patient to perform a Valsalva maneuver? The answer is 4. When you removing when the doctor is removing the chest tube, the nurse will ask the patient to do a Valsalva maneuver. Very, very, very important, guys. Very important. And those are the type of questions that always there in the exam. So now we're going for the next one. Next question. While changing the tape, let me add the question here so you can see it. While changing the tapes on a tracheotomy tube, you know the tracheotomy tube right here is when you have the patient has a trach on, and then you need to change the tape. There's a certain time for you to change the tape. Normally the nurse doesn't do that much. It's mostly respiratory. That respiratory is the one who normally do that. But depending where you're working, you might have to do it, and depend on the situation also. As a nurse, you might have to do it. So it says, while changing the tape on the tracheotomy tube, the client coughed and the tube is dislodged. Which is the initial nursing action? What will you do if while you changing the tape and then bang, the tube get out of the throat? The tube just dislodged. What would you do? Okay, here are the options. The first one says, call the healthcare provider. Will you call the doctor in that situation? The thing is, if you call the doctor, the time, you don't even know how long the doctor will take to come, right? That means there's one thing you have to do first before you even call the doctor, right? So I don't think that should be the first. That is not a good answer. You will be calling the doctor if needed, yes, of course, but that should not be the first thing you would do. When they say initial mean the first thing you have to do before the doctor comes. That cannot be the first thing because there's a delay. The time for doctor to come, something might happen. So this is not the first initial choice. So what about this one right here? Let me put it right here. It says, gasp the retention suture to spread the opening. It says like the reason you have to do that because you don't want the every second count. By the time for you to call the doctor or respiratory or anything, this part here might be inflated, and you might the doctor or you, it will be difficult for you to put the tube back, to put the trach back, if you don't maintain the opening, you don't keep it from closing. That's the reason you have to do that. Okay, so that seems a good answer. So let's go to the other ones and see. The last one says, no, that's not the last one, that's the third one. The third choice is to call the respiratory therapist, okay? Call the respiratory department to reinsert the trach. Yes, you will be calling respiratory, but is it the first thing you will be doing? Because you are the first person who get to the room. You have to do something first. I'm not sure. This is not the first thing you have to do. Because you have one first thing to do, because you don't know how busy is respiratory, how long it's going to take for respiratory to get there. So you have to do the first thing to help the patient. Okay? So, since we went over all the answers, the best thing to do is number 2, right here. Gas the retention sutures to spread the opening. This is the first thing you have to do. And this is a very important question in the NCLEX. You know, there are some of the questions that are emergency. Those are questions that are always gonna be in there. If you don't know that kind of question, you will be losing the answer. So let's go to the next one. Next question. Okay. The nurse is caring for a client immediately after removal of the endotracheal tube. The nurse should report which sign immediately if experienced by the client. Okay, you know what is the endotracheal tube? Endotracheal tube is we also call it ET tube. ET tube. Okay, so that tube is the one that goes through the mouth. Okay, the trach tube goes to the throat right here. The ET tube goes to the mouth. So they said the nurse is caring for a client immediately after removal of the ET tube. That means after the respiratory therapist or the doctor removed the ET tube, so now the nurse will be taking care of that patient. And while you're taking care of that patient, there's one thing. If you see it, you have to do something very quick about it. So let me show you the answers, and then you will choose the best one. The first one is stridor. Stridor is one of the respiratory sounds. You know, there's wheezy, crackles, wails, and then those, within those, like stridor is one of the sound. It's an emergency situation. So when you hear it, what would you do? The second one is occasional pink tinge sputum. If you see pink sputum, what would you do? Is that an emergency situation? Is it an emergency situation? You know, since the patient just get the ET tube removed, if there's not that much blood, you're still gonna see that pink sputum. You know why? Because there is somewhere in the tube or down there in the airway that is still that maybe that still has not healed yet. So there's a little blood mixed with the sputum. That is the reason it will be, you will see that pink secretion. So let's see the third answer. The third one says respiratory rate of 24 beats per minute. For that answer, you need to know the normal range. You need to know the normal respiratory range in order to choose, to know if you have to choose this one or not. Okay? You have to know the range, if this is normal or if it's not normal. Okay? And then this, and if this one is an emergency situation or if it's not an emergency situation. The last one is a few bacilla lung crackles on the right. Okay, if you hear crackles, you know what crackles mean? Crackles is like, you know, when someone has sputum. That patient is a respiratory patient, and that patient just had the ET tube removed. So that means that patient might have secretion in the airway. That's the reason you might hear crackles. And the crackles is mostly on the right side of the lung. So what you will be doing, you might have to do a little, depending on the severity of the crackles, you might have to do to suction the patient or something. So within all those four answers, which one you think is an emergency situation? Okay, we will choose stridor. You know why we're choosing stridor? Because stridor is a sign that the airway is occluding. When you hear stridor, that means there's an obstruction. After the doctor or the respiratory removed the ET tube, if you hear stridor, that means the airway is getting inflated. And if it's swell, that means it's swelling. If that happens, if there's an occlusion or an obstruction, the patient will not be able to breathe. This is a life-threatening situation. If the patient cannot breathe, they will have to go through a rapid response, like a code the patient might code, and also they might have to re-intubate the patient. And if they don't get there on time, you know what will happen. So that's the reason we're gonna choose Stridor. Stridor is an emergency situation. If you as a nurse, you hear stridor in a patient, you have to act quickly. You have to call the doctor, call the respiratory therapist, do anything that you can do to save that patient, because this is an emergency situation. Okay, so this is what this is what we're going to choose. So let's go to the next one. Next one. Let's go. Okay, let's see. Next question. The nurse caring for a client with a pneumothorax and who has had a chest tube inserted notes continuous gentle bubbling in the suction control chamber. Gentle bubbling. What action is most appropriate? You remember the first one the previous question before we had one that had it was like it was not gentle bubbling. It was like vigorous bubbling. So that was not good. But this one says gentle. You have to remember the word gentle bubbling. Is it normal to have gentle bubbling in the water seal chamber, in the suction chamber? We'll see. So it says, what action is the most appropriate? What will you do as a nurse if you see gentle bubbling in the water seal chamber? The first one says, do nothing. Okay? The first one says, do nothing. Do nothing because it is unexpected finding. That's the first answer. The second one says, check for an air leak. Check for an air leak. That means they say air leak is like there's something like there's a damage somewhere in the tube, and then you have to look for air leak. Do you think gentle bubbling in the suction control chamber is normal? Do you think it's a leak? Not sure. Let's go to the next one. The third one says increase the suction pressure. Will you increase the suction pressure? Remember, before the chest tube was applied, the doctor had a certain pressure. He set the tube to be in, so you cannot just go and change and increase the suction pressure. And also first, you have to troubleshoot, right? Troubleshoot means you have to look to see where the problem comes from. You cannot just go and increase the suction pressure. And then you see what's gonna happen? If you increase the suction pressure, the bubbling will become vigorous. This is not good. You had a gentle bubbling, and then now you're gonna have an excessive bubbling. So that cannot be the answer. So what if we go to the next one? The next one says, immediately clamp the tube. Will you clamp the chest tube? You know there's a certain amount of time if there's an emergency, if you have to clamp the chest tube, you should not go over a certain amount of time. So, and mostly, they always tell you never clamp the tube, never clamp the tube. There's one situation you have to do that, but this is not. Never, 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 because that can cause a bigger damage to the patient. Remember, the patient, you using the chest tube to remove either fluid or either air, So if you clamp it, you know what's gonna happen. You will cause there's gonna be an obstruction, and then that might cause a bigger problem to the patient. So this cannot be the answer. It says immediately clamp the tube and notify the healthcare provider. You know, the time you clamp the tube, and then the time for you to get to talk to the doctor, the time for the doctor to come, that will be a very difficult situation for the patient. This is not the first thing you will do. Okay? So I think the best answer will be do nothing. This is one of the situations where you have to do nothing. You know, as nurses, you know, you cannot just do nothing in certain situation, but in that situation, you have to do. You don't have nothing to do about it, because gentle. Remember, if you go to the exam, this is one of the question. Remember that you will see it. Gentle bubbling, gentle. Remember the word gentle. Gentle bubbling is normal in the suction control chamber. Okay? Gentle bubbling is normal. Okay, guys? So let's go to the next question. Next one. Okay, let's put it right here. Okay. The nurse is caring for a client who suffered an inhalation injury from a wood stove. The carbon monoxide blood report revealed a level of 12% based on this level. The nurse would anticipate nothing anticipate nothing with sign in the client. Let's say if the client get into it's like there's a fire, for example, and then the patient inhale, that means the patient breathe some carbon monoxide. Carbon monoxide, carbon monoxide is very dangerous for everybody. This is what's gonna stop your lung from working properly. This has to do with it's not really oxygen, it's mostly air. Okay, so in that situation, they will do an ABG in order to see the level of the carbon monoxide. They have to do an ABG. In the ABG, they will find a pH, the CO2 and the PaO2, SO2 and all that, base excess and carbon. So this is what they get, and then in that situation, you as a nurse, what will you do? What will you do if you find 12% based on this level? So let's see the choices. The first one says coma. Do you think the patient will go into a coma because of that? Don't know yet. The second one says flushing. You know when someone has a flushing face? It's like the patient will look like very lethargic and all that. Mostly when patient who has respiratory distress, you're trying to breathe very hard, that causes you to be very tired, and then you become like flushing your face like this. So, and then the next one will be dizziness. Do you think the patient will be dizzy? Do you think you will find any sign of dizziness in the patient? Or what about the tachycardia? You know what tachycardia is? Is when the heart rate goes very, very, when the heart is beating very fast. Do you think that will cause tachycardia? So the answer is flushing. The answer is flushing. Carbon monoxide level between 11% and 20% result in flushing. headache, decreased visual acuity, decreased cerebral function, and slight breathing less. That means it make you breathe less. Okay? Level of 21% to 40% result in nausea, vomiting, dizziness, tinnitus, vertigo, and confusion, and even drowsiness, pale. A level of 41%, maybe I should put that, let me put that there for you. Level of 41 to 60% result in seizure and coma. So let me get this right here, down here for you. Oops, no. Okay, I'm trying to put it there for you guys so you can see it. Okay, this is not a choice. Let's see. Let me drag it over here because you might need that information. Okay, this part right here is the rational, okay? Let me change the color for you. You know that is the rational. Okay. So the answer is flushing. Because imagine if someone is forcing to breathe, the patient might not go into a coma, right? The patient might get dizzy, but the thing is, flushing is anybody who's trying to breathe very hard and then you're tired, of course your face will be like this, like it will be like you will see flushing. Okay, so let's go to the next one. Next question. Okay, here you go. This is the next one. The emergency department nurse is assessing a client who has sustained a blunt injury to the chest wall. Which finding would indicate the presence of pneumothorax in the client? Okay, in order for you to answer this question, you have to know what is a pneumothorax. Right? Pneumo. When you look at pneumo, the word pneumo means air. Thorax is right there, the cage area, right? Where you have the lung. So if you have something, an accident happened to you and then you injure your chest, something might go through it. That will cause air to go into your lung, right? That will cause air to go into your lung. So we call that pneumothorax. Sometimes the air might not go through the lung. It might go to the layers that before you get into the lung. Sometimes we call it tension pneumothorax. But this part here, the air is in your lung, and then you receive that patient in the ER, and then they ask you which finding will indicate the presence of pneumothorax. What will you see in the patient that will make you believe that that patient has pneumothorax? So here is the first answer. The first one say a low respiratory rate. A low Will you see a low, very low respiratory rate in the patient, in a patient that has a pneumothorax? We don't know yet. Let's go to the next one. The next one says diminished breath sound. Will you have a diminished breath sound? And also here, they just say diminished breath sound. That means they don't tell you if it's to the left or to the right. You know what? Mostly, like if it's a pneumothorax, sometimes it might be a left pneumothorax or right pneumothorax. It can be in both sides. Here they don't tell you. It's just a broad question. They just tell you diminished breath sound. Okay, maybe they mean like in both sides of the lung. So the third one is the presence of bowel chest. You know what is a bowel chest? Let me explain you. A bowel chest, for example, is when you see someone with a chest that is very like a puffy. Patient who has COPD, for example, they always try to breathe very hard. At a certain time, the chest become like a very like you know those people who do like bodybuilding, and they have like that very puffy chest, you know, like they are about to fight with you. This is what is the bowel chest. Will you see a bowel chest in a patient that has pneumothorax? Let's go to the next one and then we will decide. The last one says a sucking sound at the site of the injury. A sucking sound at the site of the injury. It's like each time, okay, let's say the patient has a pneumothorax on the left side, and then each time the patient is like take a breath, you hear a sucking sound. Do you think that possible? Mostly that might happen, like, you know, if there was like liquid, you will hear that sound. If it was like you know, this is not something you will hear in a patient with pneumothorax. So the right answer for that question is a diminished breath sound. You know why? If the patient has a double pneumothorax, if it's in both sides of the lung, the patient will not be able to breathe properly. So the breath sound will diminish. Sometimes you might be osculating the patient and then you hear a normal breath sound on the right, and then you hear a diminished breath sound on the left. You might find a question like this. So when they say diminished breath sound on the left and then normal breath sound on the right, when you have a diminished breath sound, mostly in pneumothorax, they will talk to you about deviation of the lung and all that. So it's either it's too complicated for you. Let's just talk about the diminished breath sound. So if you have pneumothorax, you have diminished breath sound because of the air that is accumulating in the lung. You know, in the lung cavity, there's a pressure. There's pressure in the lung, so the lung will not be able to open properly. You see what I mean? If the lung cannot open properly, when the patient take a breath, it's not gonna take enough. It's gonna be diminished. And then when the patient try to exhale, he's not gonna do it like a normal person who has no pneumothorax. It's gonna be diminished. That's the reason you will have a diminished breath sound in the side or in the lung, if it's, you know, wherever the pneumothorax is at. Okay, that means the patient has that damage into the lung that cause air to go in. So because of that tension and then all this pressure, you will have a diminished breath sound. Remember, pneumothorax, diminished breath sound. So let's go to the next one. Next question. Okay, let's say, here you go. The nurse is caring for a client hospitalized with acute exacerbation of chronic obstructive pulmonary disease. Which finding would the nurse expect to note on assessment of this patient? Select all that apply. Select all that apply. You know COPD, it's good to know about COPD because COPD is always in the NCLEX. Always. COPD is an emergency situation because you have to know what to do for a patient with COPD. It's either about oxygenation or positioning, and then you need to know what to do for a patient who has COPD. Okay, so the nurse is caring for a client who has COPD, exacerbation COPD. Okay, and which finding would the nurse expect? What will you find in a patient that has COPD when you're doing an assessment? So the first one says hypocapnia. Hypocapnia. The second one says, you know what hypocapnia is? You know, when you have a CO2 buildup, they ask you, is it gonna be hypo or hyper? You know, hypo is low carbon monoxide, right? So in a patient with COPD, it should not be low, it will be high. So in a patient like a COPD, it will be hyper, not hypo. Hypercapnia. So that cannot be one of the answers, right? So the second one says hyperinflated chest, not on the chest x-ray. You remember before we were talking about I think that was before the previous question, we were talking about the fell chest, when I talked about the bodybuilder when the chest looked like this. So in a patient, and I told you about the patient with COPD. So this is what happened. A patient that has COPD, because of the way they forced to breathe, and then that changed the posture, the way the chest look. So this can be one of the answers. Okay, so let's go for the next answer. It says decreased oxygenation, or let's say oxygen saturation with a mild exercise. It says when a patient that has COPD is exercising, is like moving, the oxygenation goes down. Yes. Even the oxygenation goes down in a COPD patient. That's why it's very important to know about COPD patient, because you cannot give them high level of oxygen. That will knock the hypoxic drive. That will cause them to breathe, to go into let's say to have shortness of breath. You cannot give them too much oxygenation. When they're exercising, they become very deep, very tired, and then they don't have a normal lung. That will cause the oxygen to go down. The saturation will go down. You just have to, when something like this happen, you can give like a tiny bit of oxygen, like 2 liters or less. You cannot give too much of oxygen. So that's gonna help them get better. Okay. So the third one says wide diaphragm note on the chest x-ray. For a patient with COPD, the diaphragm will not be wide. Okay? Because it will not. When the patient breathes in, the way a normal person, like a normal lung diaphragm does, the COPD will do the opposite, because there's not they don't have the strength. They're not strong enough, and then the lung is not open enough for them to do it the way they're supposed to. So it's not going to be that wide. It will be the opposite on the X-ray when they're breathing or breathe out. And then the last one says pulmonary function tests that demonstrate increased vital capacity. In a patient with COPD, the vital capacity will not be increased. It will be decreased. Because the vital capacity is like the amount of air that is in the lung, you know, the amount of air the lung can carry. It will be less in a patient with COPD because the lung is not like the elasticity of the lung is not normal. It's mostly stiff and it's not going to be increased. The vital capacity will be less. That's why when a patient with COPD is breathing, when they try to breathe, they will have less air going out. And then even when they breathe in, less air, whatever the amount of air that goes in, if they breathe out, less air will go out. That's what I'm trying to say. Less air will go out because they will not be able to bring all the air that's supposed to go out. They will not be able to get it out. That's why sometimes we ask the patient with COPD to do pursed lip breathing. You know, pursed lip breathing is like they have to hold their belly and then try to breathe like do them like you have to put the mouth in a certain way like this. Try to get the air slowly out like this. So that's the only way, you know, that's one of the way for COPD patient to get the air out. That's why they always have to train them to do pursed lip breathing, okay? When they do a pulmonary function test, the vital capacity will be less because of the lung function. The lung is not functioning properly, and then so that's gonna affect the PFT, okay? So the answer for that question is number 2, hyperinflate chest. The second one is decrease in saturation. The saturation will be decreased in a patient with COPD. Okay? You might see the carbon monoxide might be high, but the saturation will be decreased. And this is the story of COPD patient. Now we're going to the next one. Next one. The nurse instruct a client to use the pursed lip breathing. You remember we were talking about pursed lip breathing? That's the way you help a patient or COPD patient to breathe. So the nurse instruct a client to use the pursed lip breathing method, and the client asks the nurse about the purpose of this type of breathing. The nurse responds knowing that the primary purpose of pursed lip breathing is to promote which outcome. So we want to promote breathing, right? So, oops, did I answer the question? Let me show you the answers, and then you will choose the best one. The first one says to promote oxygen intake. The second one says to strengthen the diaphragm, to make the diaphragm strong. The third one says to strengthen the intercostal muscle, to make the intercostal muscle stronger. And then the last answer says to promote carbon dioxide elimination. to promote carbon dioxide elimination. So which one you guys think is the best answer? The answer is 4. You know why? Because patient with COPD has a buildup of CO2. They have CO2 retention. That means they retain CO2, which is carbon dioxide. So this is the reason COPD patients cannot breathe properly, and then their oxygenation saturation is very low because of the buildup of the CO2. The lung is not functioning properly. The elasticity of the lung is not the way it's supposed to. It's become stiffer, and then so that make it difficult for them to promote to eliminate the carbon dioxide, to breathe the carbon dioxide out. So the reason we do the COPD patient, we ask them to do pursed lip breathing, when they try like slowly, very slowly, and then with the pursed lip breathing, by placing their mouth like this, they can get more carbon dioxide out. Because when they breathe fast, they breathe less. Less carbon dioxide come out. Imagine you do that. You see? Because they normally breathe fast. So that doesn't help them to get rid of the carbon dioxide. So in order for them to get rid of the carbon dioxide, they have to do pursed lip breathing. They have to breathe slowly. And then they have to place take a position to do the like this, and then so they can do the pursed lip breathing. Okay, that will facilitate the maximum expiration, and then the client who has that obstruction of the airway will be able to breathe better. So I go to the next one. Let's see how many questions I already did. 11. Okay. Let's see the next one. Those are a lot. Let me take a TB. Okay, that question is very important. Very important, guys. You need to know that. A nurse is preparing a list of home care instructions for a client who has been hospitalized and treated for TB. Which instruction should the nurse include on the list? Select all that apply. You have a patient that has TB. You need to know all the stuff that you have to do for TB. This is one of the most important questions in the NCLEX. Okay, so the first answer is, I have to go over the question so you can understand. Let's say the nurse is preparing a list of home care instruction. Home care instruction, those are things that the patient that is going home, you need to prepare a list of things that the patient has to follow. Okay? And then within that list, I'm going to give you will choose the best one. This is the first one. The first one says activities should be resumed gradually. Remember the patient just came from the hospital because of TB, and the TB caused the patient to be very weak, and because of all the underlying disease and all the other stuff that goes with the TB, right? So gradual activities should be one of them. The next one says avoid contact with other individuals except family members for at least 6 months. You hear? We have to not only look at the amount of time they tell them to stay away from family members, and also if the patient has TB, what do you think happened to the family members? There's a good chance that the family members already have it too. You see? That's why we have to be careful about that kind of questions, right? Family members, say avoid contact with other individuals. Other individual I can understand, but except family members for at least 6 months. 6 months is too much, because there's a certain amount of time after the patient was in the hospital, and that patient is no longer contagious, right? So that's why we have to be careful when we're answering that question. The other one says a sputum culture is needed every 2 to 4 weeks on medication therapy is initiated. This one is mostly in the hospital, right? They say when you start to give the patient medication for the TB, you need to do sputum collection with sputum culture. This one is mostly done by respiratory therapists. They have to do 2 to 4. They have to do sputum culture every 2 to 4 weeks once medication therapy is initiated. 2 to 4 weeks. Sputum culture. The next one says respiratory isolation is not necessary because family members, you remember we said that about family members? Family members already have been exposed to the disease, right? So there's no reason to isolate the patient from family members, because they already been exposed to the TB. This is one of the things you should tell the patient. And then the last one says, let's see what the last one says. The last answer, you have to say, tell the patient to cover the mouth and nose when coughing or sneezing, and put the used tissues in a plastic bag. This is one of the things that you have to tell the patient that has TB. So within all these, let's choose the best one. Activities should be resumed, yes. This one would say no because family members already exposed, right? And then the third one, yes. Sputum culture, yes, you have to do sputum culture 2 to 4 weeks until you get a negative result. And then this one is a yes to number 4. Respiratory isolation is not necessary for family members because they are already exposed, right? And then the last one is a yes to. Patient has to cover the mouth when sneezing or coughing. Okay, guys? Let's see the next one. I go to the next question, okay? So you have to remember this. And if you can also go over more, let me see if I can go over, let's see, more TB, more things that you need to know about TB. First, the patient has to follow the medication regimen exactly the way the doctor prescribed it. Okay, very important. And the patient has to be very compliant to the medication to the prescription. Okay, so let's go to the next one. Next question. The nurse is caring for a client after a bronchoscopy and biopsy. Which finding is noted in the client should be reported immediately to the healthcare provider? Okay, the bronchoscopy is when they have to go through the lung. Bronchoscopy, you go through the mouth, to the upper airway, and then they're going down. They will do a biopsy. They will take a piece of skin there, down there, and then they will send it to the lab, and then to see if there is any sign of any kind of disease to the lung. Okay, bronchoscopy. They go into the broncho trees down there to the lung, and then they will take a small piece to go and send it to the lab. So the question is, what will the nurse do? Which finding should be reported? If you see, what should you report to the patient, to the doctor, if you see that in a patient that just came from a bronchoscopy procedure or biopsy? This is one of the questions that you have to know. Okay? The first answer says dry cough. Will you report a dry cough to the doctor for a post bronchoscopy patient? What about hematuria? Hematuria is mostly blood in the urine. Will you report that? Does that really have to do something with the bronchoscopy? Will you report that to the patient? Do you think it's an emergency situation? What about bronchospasm? You know what the bronchospasm? It's mostly like there's like a stiffness in the like the patient can't breathe, can do nothing. It's just like stuck right there. The muscle is not moving. It's just stiff. And this is an emergency situation. Will you call the doctor about that? It's like a cramp in the muscle. Will you call the doctor about that? What about this one? Blood stick sputum. Blood stick sputum. Will you call the doctor for that? Which one you think is an emergency situation? Dry cough is not a situation, an emergency situation. Hematuria is not an emergency situation. Bronchospasming, yes. The sputum, a bloody sputum, no, because the patient just got a biopsy. Of course, you will see the blood. The only problem, if it's too much blood, if you see like hemorrhage, like you see too much blood, it's coming out, that's a different situation. But if they just tell you like a blood stick sputum, like a little blood in the sputum, this is not an emergency situation. The bronchospasm is very important, is a life-threatening situation, because if the patient has a bronchospasm, the patient will not be able to breathe. You know, the patient will not be able to breathe. So that's the reason you have to report this one. Okay? If you see hemorrhage, you will have to report. But beside that, bronchospasm is the situation that needs the attention of the physician. If you see cyanosis, which is a blue discoloration, that means there's a lack of oxygen. That means the patient is not receiving enough oxygen. If you see dyspnea, that means the patient there's a decrease in the way the patient is breathing. The patient is not able to breathe. You need to report that. It's an emergency situation. If you see stridor after the patient came from a bronchoscopy procedure, you need to report that to the doctor real quick. Bronchospasm, you need to call the doctor. Hemoptysis, if the patient is vomiting blood, like bunch of blood, you need to call the doctor. If you see hypotension, you need to report that to the doctor. This is a sign, hypotension, all this stuff are sign there's a problem. There's something going on either with the blood, maybe there's hemorrhage, maybe there's something that going on down there. It's either dyspnea, stridor, sinuses, bronchospasm. All these you need to report to the doctor. Tachycardia, when the patient is like the heart is beating very quick. If there is the hemorrhage, patient is bleeding a lot, and then there's a lot of different signs that can cause the patient to have tachycardia. Dyspnea, life-threatening situation, you need to call the doctor. Okay? Next question. The nurse is preparing to suction a client through a trach tube. The nurse should plan to limit the suction time to a maximum of which time period? Okay, here is about suctioning. When you're suctioning the patient, how long should you suction the patient for? When you down, like when the tube is down, how long should you stay down? You need to know that, because if you don't do the proper thing, like the right thing, like if you suction the patient too long, you can cause the patient to have sinuses, to have tachycardia, and all this. The patient might go to you might cause the patient to have SOB, like shortness of breath and all this stuff. So this is an emergency. This is a life-threatening situation. If you have, mostly if you're taking care of a trach patient, like a ventilator patient, a respiratory patient in general, if that patient needs suction, you need to know not to suction for too long, because each time you suction the patient, it's like you also suction oxygen. See what I mean? You suction the patient, you suction oxygen. So that's why you should not suction the patient for too long. But it's really important that you know the period of time, the number of time that you have to suction the patient for. The first answer says 1 minute. The second one says 5 seconds. The third one says 10 seconds. And the fourth one says 30 seconds. "30 seconds is too much. You cannot suction a patient for that amount of time. It's too long. Okay? So we eliminate 30. 1 minute is too short. No, 1 minute is too long. Because we have to see that is confusing, because we see one, we have to remember minute is minute and second. This is minute is like 60 seconds. So we have to be careful. So we eliminate 1, we eliminate 4. So now we have 5 seconds and 10 seconds. 5 seconds is not enough, so we're going with 10 seconds, okay? So 10 seconds is the amount of the time that you have to suction the patient, okay? Mostly 10 to 15 seconds, but let's say 10 seconds. Let's keep that one. 10 seconds, because if you don't do it that way, you will be suctioning, you will be removing too much oxygen, that will cause the patient to have hypoxemia. Okay, hypoxemia is one of the causes of lung suctioning. You have to be careful. And you might have a vasovagal nerve response. You might have vagal, or you might also cause a bradycardia, and you might cause like vaso nerve damage. You have to be careful. And the way you're suctioning also, you should not be too tough. Okay, guys, this will be the. Should I end over here? What's that? Next question. The nurse is suctioning a client through ET tube. During the procedure, the nurse notes the monitor that the heart rate is decreasing. Which nursing intervention is most appropriate? Okay, this is what is going on, guys. While the nurse is suctioning the patient, she looks at the monitor and then she sees that the heart rate is going down. What should the nurse do? Should the nurse continue the suction? That's the first answer. Do you think the nurse should continue the suction? The second one says, notify the healthcare provider. Well, you call the doctor because you see the heart rate is going down while suctioning. Remember, it's happening while you're suctioning the patient. Will you call the doctor? The third one says, stop the procedure and hyperoxygenate the patient. It says, stop suctioning the patient and give patient oxygen. Do you think this is a good choice? And then the last one says, ensure that the suction is limited to 15 seconds. What is the most appropriate? The most appropriate. I mean, it's like they tell you, one of these answers is the best thing to do. Which one you think is the best? Which one you think is the best thing to do right here? The best thing to do is to stop suctioning the patient and get the patient some oxygen. The reason the heart rate is decreasing is because the patient needs more oxygen. Okay? You need to monitor the patient closely for side effects of suctioning, including hypoxemia, cardiac irregularity, such as a decrease in the heart rate because of the vergo. That happens mostly because of the vergo nerve stimulation. When you stimulate the vergo nerve, that causes the heart rate to go down. Okay? The vergo nerve and trauma to the mucosal. That's the muscle in the right there in the upper airway. You have to be careful not to be too tough, too rough. You have to monitor for hypotension. And then you have to hyperoxygenate the patient. So you have to give oxygen to the patient so that will fix the problem. Okay? Next question. So okay, let me stop. Let me put it in green for you so you can remember. Oh, this one I did not choose. Okay, green. And put it in green. Okay. The nurse is assessing the respiratory status of a client who has suffered a fractured rib. The nurse should expect to note which finding. The nurse is doing an assessment for a patient, but she realized that the patient has a rib fracture. And then they ask you what you think the nurse will find. What is unexpected, something that is expected for a patient with a rib fracture. The first one says slow, deep respiration. Well, a patient with a rib fracture has slow and deep respiration. The rib fracture caused respiratory status to decrease or increase or something like this. So the reason why they put some of the answers has to do with respiration. They just want to see what will you do, what you think is an expected finding. And then you see here the second one say deep, rapid and deep respiration. Do you think it's one of the finding? What about the third one? Paradoxical respiration. It's an abnormal respiration also. What about the last one that says pain, especially with inspiration? Do you think the patient will have pain each time the patient is trying to breathe? So which one you think is the best answer? The best answer is 4. Because of the damage to the fracture of the rib, the patient will have pain each time the patient trying to take a breath, so trying to breathe in. Okay, you breathe in, you have pain. That's how you're gonna feel it. The patient will feel pain each time the patient trying to take a breath. Okay guys, so we're going to stop here for today, and we will come back next time with more question for you. Okay, and we might continue the respiratory session. And also don't forget to subscribe, so we can, each time I upload a video or I'm live, you will get a notification if you click the little bell that shows after you subscribe. Okay guys, so see you and keep studying. You can do it.